Hello, everybody. Welcome to the Obesity Matters Wellness Workshop, where we embark on an incredible journey together towards better health and wellness. Whether this is your first time or you have been with us since we started the program, we are so grateful you are here. My name is Rachel. I am the Vice Chair of Obesity Matters, and I am your host for this year-long program. Today's topic is, it's hot. Oh, those hormones. Let's talk menopause. Today we are joined by Dr. Kimberley Sampson Paine. Kimberley, please tell us a little bit about yourself before we dive into today's topic.
Yes, thank you so much. It's such an honor to be here, and so many of you on screen. That's fabulous. I'm an OBGYN. I have been down here in Vermont for about a decade. You can tell by the accent, I am not originally from here, despite it being New England. I'm from the original England. I specialize in lifestyle medicine. I'm also obesity medicine boarded, and I'm a menopause specialist. And I really kind of came to this and came to what I do on a day-to-day basis because of the fact that we really don't get a lot of training in menopause. We don't get a lot of training in obesity medicine and lifestyle. That's not our general curriculum. And so every day I was trying to show up for each of us, for women, and really probably not doing a great job because I really didn't have sort of that backing and that training. So myself went through several rounds of IVF, woke up in my 40s here and realized, whoa, what is going on to my body? What is going on to my mind? And realized that I needed to do better for myself and for my patients, and decided to take a deeper dive. And this is where I've ended up, and loving every minute and speaking to 20 to 30 patients a day on this exact topic. So it is so nice to do it in one go rather than individually, kind of bring these kind of the questions I'm sure you all have are the same questions that I had and still continue to have. I'm continuing this journey with everybody. So it's a pleasure to be here.
Thank you for showing up for us, because I was so excited when I heard about you joining us, and I got to learn a little bit about your background and your experience and your passion. So thank you for being here. Now let's actually start with the very basics. What's actually going on in our body through perimenopause, menopause, and why does it show up differently from one woman to another?
Yeah, so I think probably even if we go to the super basics beyond that, let's talk about the terminology, right? So I think there's a lot of confusion with the word perimenopause and menopause. Peri just literally means pre. I think that's a little bit of a misunderstanding. The perimenopause is this transition that leading up to this menopausal zone. The idea behind that, the definition is that if you have a uterus, your periods have stopped for a full year. And so when I say you have a uterus, because people like me sometimes take them out. So I think also that becomes a little bit of a hard stop for many of us. Full definition, my periods have gone. We're very much regulating this period of time in our lives by the uterus. But I like to think of the uterus as the friendly house at times, or not so friendly at other times. The ovaries are the piece that are actually doing a lot of the hormonal transitions. The uterus is the piece that we're able to see and quantify some of those pieces. So it's a transition time. It's when those hormones are fluctuating. So specifically, people have heard of some of these hormones: estrogen, progesterone, testosterone. So these are fluctuating within the body. Again, you mentioned about it can be different for different people. Really widely varies sort of within the audience that will say, I've never had a hot flash, I've never, all the things that we're going to talk about today, they're going to be like, no, I've never experienced that. I did a speak recently, and there was one person in the audience and she was like, no, none of this is me. And I was like, well, don't tell everybody else, they'll run you out the room. So I think it really does vary widely because of the fact that we're human and we're different, right? So we have different genetics, we have different body composition, different stress levels, social determinants of health, trauma history, pre-existing conditions like PCOS, infertility, depression. I think we all go through our own journeys. That's kind of how I describe what perimenopause and menopause is. It's a transition, it's a journey. It is not a straight road for anybody that I've yet met. There's definitely a little yellow brick hanging out right there. And I think if we think of it in that way, maybe we all might process things a little bit differently. It's definitely a period of change. But one of the things I really like to think of it as is a neuroendocrine recalibration. By that, I mean, at the beginning, I explained that it's about the uterus, but we're more than just our periods, right? So this is our brain chemistry, our sleep cycles, our metabolism, our emotional regulation, all of these pieces are part of that journey.
What are some of the lesser known signals that, can tell us that we might be in that stage?
There are many, and I'm pretty sure I hear more every day, all things that we could certainly try to create some associations with. I think also what you mentioned right there about the hot flashes, that's the one that everybody knows. And I think it's also become a little bit almost dangerous to describe menopause as the hot flash piece, because so many people come in and speak with me and they're like, oh, but my provider said that I can't be perimenopausal, I can't be, these pieces because I don't have hot flashes. And I was like, neither do many people. Let's talk about what you do maybe have. So some of the surprising ones I definitely had to look up when I was hearing the stories and be like, let me see. Itchy ears. That was a good one. I was like, I had never heard that. And then I started exploring a little bit more. It kind of makes sense, right? If you think about dry skin, hair changes, little itchy ears, right? We think about like the vaginal sort of canal and some of the sexual dysfunction pieces. We're doing the itchy scratchy dance in the chair. All of these pieces, the ear's the same. It's just a canal, and we can certainly have adjustments in our hormones that are going to impact our skin. So that was a new one for me. I'd also heard the burning tongue, the dry eyes. Myself, it was joint pain. I literally woke up one morning and was like, no, I definitely don't recall falling or doing anything exciting. I definitely didn't go dancing. And my hip was really a discomfort. And I got diagnosed with bursitis. Why at 43 do I have bursitis? And I started exploring more and more, speaking and engaging sort of in this sort of field and speaking with patients. And I was like, cha-ching! Oh, that's me. And now I might want to talk about supports. Joint pain, heart palpitations. So we think about the cardiovascular piece, right? So we're, like I said, it's a full system component. Your body's working differently, a little bit harder, your fluid shifts, just like they do in pregnancy, to be fair. So heart palpitations, maybe some dizziness. I did have one patient describe electric shock sensations that she had never felt before. And again, when we walked through her journey, they were transitional. You mentioned mood. Mood is complicated. I think it's also an extra hard deal around our 40s and 50s. Many of us are caring for maybe children. Maybe we've become sort of transitional and we've got children heading out to the college. We become empty nesters. We're looking after more elderly parents. So we're very much caregivers. Many of us are also working. Our workplaces are not set up for us to be sort of functioning as perimenopausal and menopausal women. That is incredibly clear every day when I go to work and I'm not sure if I get to eat or use the bathroom or any of those canopies in the medical profession. And I'm sure many of you share the same.
I know I have a couple of women in my life that are now in their late 70s. I'm like, I don't think I went through menopause. I'm like, okay, but hot flashes are not the only sign, and I feel like maybe you did. I'm assuming they must have gone through some transition, but there, we don't often pause through the initial part to ask questions, but I do have to ask this one question. It's around hot flashes and can they happen post-menopause, and is it a concern if it happens? I think maybe just tell us a lot of the symptoms you talked about. I mean, how do they carry through to menopause and beyond? Or is that it? Is it menopause is a point in time and then you're post-menopause?
So yes and no. So by definitions and by categories, right? So when you think of, it's no different to any other points of our lifetime, right? So we were children, we were adolescents, we went through our cycles. It's like basically I think of menopause as adolescence in reverse, but now we just know better. It's a totally different kind of piece, and we do, I think, a really great job with our adolescents. They're going through it together. Maybe there's the pimples, there's all this thing. We're kind of supporting them there. And then we don't necessarily do that, which is why I'm so glad that we're doing this now, that we don't necessarily have the same conversation, expectation of what that's going to look like beyond a hot flash, right? And so I think that's also that struggle. So we go through this peri or pre, whatever we would like to call it, and then we're into this menopausal zone. And like I said, for our definition, it's no more cycles for more than a year that we didn't initiate. So I didn't take out your uterus, it was a natural progression, right? There are some people that go through early, so there's premature and early menopause as well. So again, the average age in this country is 51 to 52, similar in Canada, similar in the UK, but then we transition into this after phase. Now, a lot of the symptoms that I've mentioned can actually feel quite distressing in this peri and pre zone because of the fact that you feel like you're being gaslit by your body, right? It's all about the fluctuations. I wake up one morning and it's this. I wake up another morning and it's this. And you just don't know whether you're coming or going, specifically emotionally, like that roller coaster. And there are other people that what comes with that level is basically a significant drop in those hormones, and that can look like different things for different people on the other side.
So let's just dive into weight gain during menopause. Typically, for many people, can be very sudden. It's really frustrating, and then it's so hard to get rid of it. So do these hormonal changes actually affect our metabolism and how the fat is distributed in our body and even our level of appetite? Tell us everything about weight gain and menopause, please.
The big thing is this is the stuff that I talk about probably most readily in the office, right? People know that I do both lifestyle, obesity, and the menopause piece, and I bring them all together. Yes, when our hormones adjust, yes, we definitely can undergo some changes, and that can definitely be distressing. And I think everybody's journey is a little bit different. There are people that it feels like overnight we suddenly are having a different distribution, and the distribution is important. People often notice it's a little bit more central. We can also notice more of a loss of lean muscle mass, and maybe if we're somebody that has been very active, I've been working out, I lift, I do resistance training, and now it's not as easy for me to maintain that muscle mass. I think that's really important to observe that is definitely a piece that we see. We get, like I said, more of that central, so more increased visceral fat, or again, I think the term that many people use is belly fat. It's important to recognize that this is, it's not just a number on a scale. It's so much more than that, because it impacts our health. We know that increased visceral fat can certainly cause more health issues. So we're talking about trying to reduce women's risk of cardiovascular disease, and we're turning around and saying, well, actually, my body is going against me. So what's actually going on is the estrogen, sort of as it's dropping down, it's contributing, many people have heard of insulin resistance.
Thank you for joining us today. And remember that our journey towards better health and wellness is not a solitary one. We are here to support and uplift one another. See you next time.